Hello, this is Chris from the Obstacle Doc, and today we are going to talk about active toe or big toe depression or plantar flexion. Basically what we're looking at is how well we can stabilize our foot in our arch through our big toe. This is very important for all of our weight-bearing activities, standing, walking, running, jumping, any sports-specific movement, because at the very last second when we push off, our big toe is what helps to both help that movement occur, but it also helps to control our foot and arch's kind of stability. So this is a big implicator when we think about people who suffer from big toe traumas or injuries, whether it's a turf toe or an arthritic big toe or a bunion, even a post-operative case of bunion fixation or alignment or fusion. These are all going to affect the big toe's capacity to push. So we want to really try to think about, can we educate that, retrain that, can we build that back up to the best degree that that person's foot can allow so they can use that and have that stability in their push-off. So a way we can assess and test this is the following. So with Daniela's foot down, we're focusing on this first knuckle or the MTP. We want to try to avoid this second knuckle. The reason why is the muscles that control this last one aren't as directly impacted into the arch control of the foot as the first knuckle. So as Daniela is demonstrating, as she looks to press the big toe down, thinking it kind of like a lever, not a scrunch, but as she pushes down, you can see how the arch lifts, and when she relaxes, it kind of drops down. Now the little toes are going to want to help, that's okay, but if you kind of channel your focus here, that's what we're going for. We're also watching for compensation through the rest of the foot and the ankle. Where you might feel this working, there's a small muscle here, and there's a muscle that actually is in the back of the lower leg, and its tendon courses down through. They both kind of connect into this area, and that's what helps to drive that motion. So from a re-education standpoint, especially when there's less weight bearing, this can be a great level 1 exercise, doing repeated big toe presses into the ground to create that arch lift, 10 to 20 in a row, comparing the other foot because you want to have a standard to know, especially if your other foot can do it better, or let's say it's the non-operative foot. Again, you want to understand what you're trying to get to. So it's a nice goal to be able to compare both feet. We can also transition to standing from the floor as well. So in a stance position where we have a little bit more weight on the ground, we're looking to try to achieve the same thing. So Daniela is trying to press down to create that arch lift. Again, comparing both sides. Okay, good. A pretty novel device that's on the market is referred to as the MOBO board. This was developed by a physical therapist. It's an excellent kind of way to retrain the big toe in a balanced position. The board is a little bit different than a traditional wobble board in that the pivot points are actually more anatomically accurate to the way the foot actually moves, as well as it has a cutout specific so the smaller toes can't help making the big toe have to kind of do the predominance of the balance point. So the idea is having something to hold on to start with. Danielle's going to come up on the board. Now while she's holding, we're going to try to get used to the board itself, but the objective is using that same big toe press on its individual platform while the smaller toes are floating. She is actively pressing through her arch and big toe to keep the board level, equidistant all the way around the board. So bottom line, we don't want the board to tip backwards, creating a big space here. So as she leverages down to try to level the board, that is kind of taking that same big toe press that we did. Now, things you want to watch for is using weight shift or swing or momentum to leverage the board. Bottom line, you want to try to focus just on the big toe. As the client gets better with it, as you can see, you can let go of whatever you're supporting yourself on, trying to hold this on your own. Static single leg stance, she can work towards 30 seconds or beyond. We can also get really creative with this in more advanced cases where the client can start to move with it, really in any myriad of motion that is specific to their movement demand problems, but with the goal of fixating still on that big toe, holding the board, doing a really good job. still and stable at the same time. You might also feel other activity up the leg. It is very common to feel your hip start to work or get a little bit tired. That's actually really good because what you're feeling is the connectivity between the upper half of the leg and the lower half of the leg at the same time. There are other creative ways you can use this board, but for basic level 1, the idea of keeping the board still is a great start. And finally, if you don't have a board, and we teach this in clinic, the nice thing is you're kind of learning the feeling. So if we take the board away and Daniela goes back to a single leg stance, she's going to work on imagining that same board is there and using that big toe to press to keep that whole foot level as she goes into her movements. So we can take the learning curve created by the board and use that to help with our homework.